Good afternoon, everyone. Thank you very much for joining me today. I am honored to present to the advisory committee here as I explain a very important health issue faced by many Americans. So I would like to start by introducing myself. My name is Madison Young, and I am a researcher here within our organization. The purpose of my presentation today is to go over an important health issue, give you an overview and background of this topic, along with a few suggestions and interventions which I believe would be very successful in decreasing maternal mortality and morbidity rates in the United States. So we'll get started here. And to give you some more information on the health issue and why this is something that public health officials need to take seriously is there are racial disparities in maternal and child health in the United States, and although there have been improvements made over the years, we still have a lot of work to do. Black women in the United States experience disproportionately high rates of maternal mortality and morbidity, and there are a variety of factors which impact this and are kind of causes for this. So that includes lack of health care, maybe someone doesn't have access to the right services, they might not feel comfortable navigating the healthcare system, there could be lack of training for healthcare professionals, poor screening and surveillance systems in place that maybe are not identifying the right high-risk individuals and providing them with the proper care, and systemic racism and discrimination along with unsafe medical procedures depending on the environment. We use a socio-ecological model for a variety of reasons, but it's really a holistic approach to the health issue, and it helps us when we're determining areas where we can create an intervention and gives us a wide range of factors to consider at all different levels. So the 5 levels here would be individual, interpersonal, organizational, community, and policy, and with each of these levels there are pros or positives and negatives that contribute to public health and public health promotion. So for example, at the individual level, one factor that can promote public health is health literacy and education. So educating African American women can empower them to make choices that are best for themselves and their families. And one way that it might hinder public health promotion, or one factor, would be personal kind of attitudes or behaviors towards nutrition and exercise, as obesity can be linked to poor birth outcomes. So that kind of gives you an example of what we look at when we're looking at each of the different levels and how that can be tailored for our interventions. And one of my primary roles as a researcher is to, of course, research and identify effective interventions that have been either effective in dealing with similar health topics or something that could at least be modified to our health topic of maternal morbidity and mortality. So the first one here is screenings for high-risk individuals by clinical decision support systems. The second would be midwives and doulas in a home setting. And the third is cultural competence training for healthcare providers. So screening for high-risk individuals is a very effective intervention, and the clinical decision support systems in facilities, they use a variety of tools and different types of technology to help identify high-risk patients. So for example, when an individual visits their primary care physician, there might be an alert that pops up on one of the devices that the physician is using with a survey to prompt and ask for questions that might help them better identify the proper care and treatment that that specific patient is needing. So it's really just more of a tailored approach to healthcare. The second would be midwives and doulas visiting in a home health setting. So they actually show up in your house, they help you during the entire pregnancy, during childbirth, of just really equip you with the right resources. And this is more for populations with limited access to healthcare and high-risk individuals. There have been recent studies that have shown it's very successful, and it just helps kind of having someone that you can trust and guide you throughout the entire pregnancy. The third intervention would be cultural competence training for healthcare providers. This is very important as oftentimes people will not maybe seek medical attention, or they won't visit their primary care physician if they even have one, because there could be language barriers, or they're not sure how to navigate the facility, or feel like they might be judged by their physician. So this really helps to shed light on disparities. It helps improve the entire patient experience while they're at the physician's office, and it can be focused really around a variety of health topics, but specifically in this case, maternal health and just different kind of diverse backgrounds that physicians can work with. And in order to evaluate these interventions, I would compare maternal mortality and morbidity before and after the intervention. And this would include things like how many preterm births were there, how many follow-up visits, the death rates, of course, of both mother and child. And we would track the follow-up visits and hope to see that increase by at least 20% following the intervention. This would also include tracking or evaluating the patient's knowledge and cultural competency. So how are the trainings going? In which ways could we improve? We would provide surveys for patient feedback, letting us know how they felt about their experience. And high-risk patients are identified and referred to specialists, hopefully 30% more than they were before the intervention. Potential challenges or barriers that we may run into when trying to implement these interventions would be being able to modify them for each community. It's important to focus on the specific risk factors or causes within that community and how we can really tailor it to them. Lack of funding, which is why we're always trying to partner with stakeholders. We're looking for additional funding just to make sure these interventions are successful, as it's really a top priority, in our opinion, for reduce the rates of maternal mortality and morbidity across the entire country. Holding the staff accountable, making sure that they're passionate in what they're doing, they are qualified individuals, having the resources, and then time. Here with my logic model, you'll see the inputs include the resources that would be necessary. The activities would be the actual interventions, and then the ultimate goal here is the final or long-term impact that it would have, and that is to decrease rates of maternal and child mortality and morbidity among African Americans in the United States. And I really appreciate you taking the time to meet with me today and letting me discuss this important issue with you. I hope that you can see that additional funding is needed, and although we have made progress, we still have a long ways to go. Thank you very much.